In fact, we can discuss this concept of limbic system, which helps us to describe a circuit that relates telencephalic structures and their cognitive processes with the hypothalamus and its outway pathway. And ultimately, we know that hypothalamus is associated with various functions, such as there are autonomic functions, so autonomic activity hypothalamus is involved with, somatic functions it is involved with, and it is also related with the endocrinal functions, as it has a close association with the pituitary gland. So ultimately we can say that a lot of these functions are managed or are associated with the limbic system. Now let's talk about the components of the limbic system. Now it forms a complex network for controlling emotion. So there is a complex network, and let us first discuss, or let us first just revise the important components, and then we'll go into the details of these components. So whenever you are writing your exam, it's very important to write all these important components. So I'll also give you a mnemonic to remember. First is the limbic cortex, which includes the cingulate gyrus and the parahippocampal gyrus. And parahippocampal gyrus, you know, it is the part of the temporal lobe. Then there is hippocampal formation. Hippocampal formation again is present in the temporal lobe, and it has three important parts. One is the dentate gyrus, hippocampus, and subicular complex. Again, you can remember this with the mnemonic DHS. We'll talk about this when we come to hippocampal formation. Then there is amygdala. Again, amygdala is a part of the temporal lobe, and again I'll tell you important nuclei, important components of amygdala. Again, I'll give you a mnemonic. The mnemonic will be A, B, C, D, E. So by this mnemonic, we'll remember all the important nuclei of the amygdala. Then next is the septal area. Again, there is a small septal area which is associated. And ultimately, it is the hypothalamus, a very, very important structure, and we'll discuss all the important nuclei of the hypothalamus. And lastly, there are also other related thalamic and cortical areas. So these are the 6 important components of the limbic system. Again, how to remember all these important components? So nowadays, you know, anything which is trending, we put a hashtag. So you can write down hashtag LS. LS is what? Limbic system. So how to remember all these important components? So L, of course, is the limbic cortex, and this hashtag you can remember with the term hash, HASH. So H basically stands for the hippocampal formation, A is amygdala, S is the septal area, H is the hippocampus including the mammillary body, and S you can remember certain other structures related to thalamic and cortical area. So this is the mnemonic to remember all the important components, and also you can remember with the sequence as well. Now let's talk about the first and very important component, which is the limbic cortex. Now this limbic cortex, it is situated at the inferior medial aspect of the cerebral hemisphere. So if this is the cerebral hemisphere, it is present in the inferior and the medial aspect, and it consists of 2 concentric gyri surrounding the corpus callosum. So basically Broca proposed that there are 2 of these rings. One is the outer gyri and there is the inner gyrus. Now this outer gyri, it is the limbic gyri or the limbic lobe, which is known as, and consists of isthmus of cingulate gyrus, parahippocampal gyrus. So cingulate gyrus, parahippocampal gyrus, basically they are connected by the cingulum and also the subcallosal area. And then there is the intralimbic gyri. Now there are 2 important structures which one should remember. Let us discuss these 2 important structures. One is the cingulate gyrus and the parahippocampal gyrus. So first let's talk about the cingulate gyrus. Now if you see in this diagram, this is the cingulate gyrus which we will be going to discuss. So if you see, it is related with the corpus callosum, and this region is the diencephalon. So we'll talk about this cingulate gyrus, which subsequently will be connected to this area which we'll discuss is the parahippocampal gyrus, and this is connected via the cingulum. So this cingulate gyrus basically is a C-shaped structure. It's a C-shaped gyrus. In Latin, basically, it is meaning a belt ridge. Now, dorsal to, and it follows the corpus callosum. As we seen, it follows this corpus callosum, cingulate gyrus, and basically it includes several cortical regions that are defined by their relationship to the corpus callosum. So there are various regions of this cingulate gyrus, and they're named by the relation with various areas of the corpus callosum. Let's try to discuss this again. This is very basic understanding. Once we understand this, it will be very easy to correlate all these areas. And again, sometimes we get confused. So let me just discuss these basics. So when we talk about the corpus callosum, let us say this is the anterior part and this is the posterior. So these are the important parts of corpus callosum. So this is the rostrum, this is the genu, this is the body, this is the isthmus, and this is the splenium. Now, based on the relationship of these areas, the various cingulate gyrus areas have been named. So let us now discuss the subdivisions of the cingulate gyrus. Now, in this, if you see, this area is now, since it is below the genu, it is known as subgenual ACC. ACC is anterior cingulate cortex. Then this is before, so this is pregenual ACC, anterior cingulate cortex. Now this is the mid cingulate cortex, so this is in the middle part and near the body. Then this is posterior CC, that is posterior cingulate cortex, and this area, it is behind the splenium, so this is retrosplenial cingulate cortex. So these are the important cingulate cortex area, and you can understand their names by the relation with the corpus callosum. Now this subgenual ACC again is important, so let's discuss this. Certain implications are related with the psychiatry. Of course, other areas also. Let us discuss subgenual anterior cingulate cortex. Now this is connected in fact to various other areas such as the amygdala, the hypothalamus, via the callosum bundle, via the uncinate fasciculus, and by the subcortical fascicle. So via various white fiber tracts, they are connected with some of the important areas such as amygdala and hypothalamus. And you would appreciate that these areas we have also discussed when we're talking about etiology of mood disorders such as depression. So these brain regions are often associated with depression. So an important clinical implication is that imaging studies have shown that there is an increased activity in the subgenual ACC and in patients with depression, and treatment such as antidepressant, ECT, RTMS, they have shown subsequently to decrease this activity. So again, these areas have been implicated in depression, and it is shown that via the treatment, these changes may be reversed. In fact, preliminary studies of deep brain stimulation. So nowadays, a lot of new strategies, new techniques have been devised for treatment of important psychiatric disorders, and deep brain stimulation again is an upcoming branch. So it is seen that deep brain stimulation in treatment resistant depression of this area, that is the subgenual ACC, and the underlying white matter, as you know, it is connected to some of the important areas related with depression, that has proven in preliminary studies to be effective in delineation or elevation of these symptoms. So again, very important to understand a lot of clinical implication. So next time when you read DBS and you see that one of the important areas which is stimulated is the subgenual ACC, so now you can correlate because of its association with certain areas which are implicated in depression. Now also, since we are discussing this, let us also discuss habenula. So briefly, I'll also talk about habenula. It is technically a part of the epithalamus, and it has again significant connection with the limbic system. So it has two divisions. One is the medial subdivision and the other is lateral subdivision. This lateral subdivision again is in fact important. Let's discuss some important points related to this. Now, in the lateral subdivision, it connects the limbic, the basal ganglia, and the brainstem circuits. and especially those involving projections from lateral habenula to the serotonin neurons of raphe nuclei and dopamine cells of the ventral tegmental area. And again, it has been suggested that this lateral habenula may be involved in mood regulation and various mood disorders. Now, also again, in fact, preliminary studies have shown that lateral habenula for the deep brain stimulation has shown improvement in depression, especially treatment-resistant depression. So again, certain clinical implications when we understand these area, which area to stimulate, so that we can treat those disorders. Now, this was about a short, note about habenula. Now, let's come back to the cingulate gyrus. So, we have been talking about cingulate gyrus, the first part of the limbic system. Now, it is heavily interconnected with the association areas of the cerebral cortex, and it travels posteriorly. So, posteriorly, basically, it travels via the cingulum bundle of fibers in the white matter, and subsequently it becomes continuous with the parahippocampal gyrus. And this parahippocampal gyrus, as we discussed, is situated in the medial temporal lobe. So again, let's come back to this diagram which we have been discussing. So this is the cingulate gyrus, and if you see, it is subsequently via the cingulum is connected to this area, and this area basically is the parahippocampal gyrus. So this area, in fact, this is the limbic. This area, in fact, is the temporal lobe, and parahippocampal is present there. Now, let's talk about the parahippocampal gyrus. Now, this is located in the medial temporal lobe, as we discussed, and it contains several distinct cytoarchitectural regions. So, there are various cytoarchitectonic regions, different regions are there. And one of the most important region, very important for limbic system, is the entorhinal cortex, ERC. It is one of the important region, and this ERC basically it funnels highly processed cortical information to the hippocampal formation, which we'll discuss. So very important. So this is connected to the hippocampal formation, and it also is a major outflow pathway from the hippocampal formation. So again, this circuit is very important. So it connects with the hippocampal formation. It also is a major outflow for the hippocampal formation. So this to and fro information or connectivity is very important. So let's now come to the second component of the limbic system, that is the hippocampal formation. So we have discussed the limbic lobe, which has two parts, CP, remember, it is the cingulate gyrus, and second is the parahippocampal gyrus. Let's talk about the hippocampal formation. Now, embryonically talking, this hippocampal formation is basically an extension of medial edge of the temporal lobe. Again, so it is related with the temporal lobe. And the length of this hippocampal formation is roughly around 5 centimeters. And this basically, it extends from, so the anterior end is extends at the amygdala. So there is amygdala, and near that is the anterior extent of the hippocampal formation, and tapering backward posteriorly near the splenium of the corpus callosum. So this is the structure between amygdala and the posterior and near the splenium of the corpus callosum. Now this is in fact located in the floor of the temporal horn of the lateral ventricle. Now again, let us look at this image which we have been discussing. So this is, again I'll repeat, this is the cingulate gyrus, which is continuous with this structure, that is the parahippocampal gyrus. And this structure, if you see above in this diagram, above the parahippocampal gyrus, this is the hippocampal formation, and this was we are talking about. So this structure, that is the hippocampal formation, if you see anteriorly, it is this structure is the amygdala, and posteriorly it is near the splenium of the corpus callosum. So this is the splenium of the corpus callosum. Now let's talk about the hippocampal formation. Now this hippocampal formation, it has 3 zones. So there are 3 zones, and they are composed of adjacent strips of cortical tissue that run from rostral to the caudal direction. So from anterior to the backward direction it runs, but they fold over each other mediolaterally. So they are running backwards, but they fold over each other mediolaterally and in a spiral fashion. So there is, they fold in a spiral fashion. They go from anterior to the posterior part and giving a C-shaped appearance. So there is a C-shaped appearance of this hippocampal formation, which we'll discuss. Now, before discussing this, let's just first understand the three components, then we'll separately discuss these components. So one is the dentate gyrus, then hippocampus, and subicular complex. So there are three important structures of the hippocampal formation. How to remember? Let me give you a mnemonic. HIP. Remember HIP. And if you remember, during MBBS in orthopedics, there was a screw known as DHS, that is the dynamic hip screw. So remember HIP for hippocampus, dynamic hip screw, DHS. So this way you can remember the three important components. Remember the limbic structures, limbic lobe, you remember by CP. This is the hippocampal formation, DHS, dentate gyrus, hippocampus, and subicular complex.